Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video in response to a question that was posted on a previous video that I had put up about the importance of making sure that a person's blood pressure is in as close to an optimal range as possible. And with the context of a person with low blood pressure not feeling as healthy as they possibly can, if their blood pressure is too low. The importance of optimal blood pressure, or the importance of your blood pressure not being too low, is that if your blood pressure is too low, it's hard for all of the nutrients and oxygen to get from your blood into all of the tissues in your body. Kind of like if you're having poor or low shower pressure, it's just not going to be a very efficient shower. Similarly, if your blood pressure is too low, you're not going to have that efficient delivery of nutrients and oxygen to your cells. And so folks who are struggling with low energy and brain fog and not healing as quickly as they should, and struggling with other health issues potentially, it might be an obstacle to them feeling as well as they can, as efficiently as possible. So the question that was posted in response to that video was, well, how the heck do you bump up the blood pressure? And that's a very, very good follow-up question to ask. So when it comes to bumping up blood pressure, there's kind of two categories in which to answer that. So one category is that we need to look at the root cause of why the blood pressure is too low in the first place. There are various reasons why blood pressure could be too low. And barring any major medical emergencies, like the person's bleeding out somewhere internally, in my patient population at least, where many of my patients are suffering from complex chronic illness, dealing with things like mold illness and Lyme disease and co-infections and different things like that, they are oftentimes I think, based on my experience and to my understanding, experiencing that low blood pressure, at least in part related to, at least in part in relation to the presence of those very infections or mold toxins, or maybe heavy metals or other things like that. Especially with mold mycotoxins, they have been documented to interfere with the expression of this hormone in the brain called antidiuretic hormone that's really important for helping to ultimately maintain optimal blood pressure. There can be other links with some of these other microbial types too, but the long and short of it is that when a person's suffering with symptoms related to some of these underlying causes of health issues, it's really important to address those underlying causes so that we're actually getting at the root cause of why the blood pressure is low in the first place. Now, anyone listening to this video who's dealing with chronic symptoms might be thinking, yeah, it doesn't happen overnight though. You don't get rid of the root cause overnight. Every once in a while you do, but it's very rare, unfortunately. And so as a person is plugging away at addressing those root cause factors, is there anything that we can do to help mitigate those symptoms faster by boosting up blood pressure into a healthy range? So there are different tools that can be used to that end, and anything I say from this point onwards, and anything I've said up to this point, please don't construe this as medical advice in any way, shape, or form. Please talk to your healthcare provider about this. It's really important to make sure that anything you're working with that might affect your blood pressure is being monitored, because if your blood pressure goes too high, that's not good either. If it's too low, as discussed, that's not good. You really want that Goldilocks, just right kind of blood pressure. One of the things that can be the most useful to help increase blood pressure that's too low is working with the right amount of salt. And salt is something where pretty much everybody knows that if you consume too much salt, some people anyways, if they consume too much salt, then it can increase their blood pressure. And that's a bad thing if your blood pressure is already normal or too high to begin with, but if your blood pressure is too low, it can be very useful. In terms of the exact dosing and methodology of getting salt into your system, again, you'd have to talk to your healthcare provider about that. But one thing I will mention is that salt in food is good in terms of getting more salt into a person's system if it's indicated and prescribed, but salt in fluid is typically clinically better. So some patients that I work with, they'll say, yeah, like I have low blood pressure, and my family doctor or somebody was telling me to consume more salt, and so I'm doing that. I'm like salting my food and like eating lots of salty food and whatnot, and that's all well and good. That's fine to do that if it's prescribed by their doctor, but what tends to be more effective, in my experience at least, in terms of bumping up blood pressure, is by getting more salt in the fluid that a person is drinking throughout the day. And the idea there is that the salt, or the water rather, is kind of metaphorically, but kind of literally, going to chase the water into the person's system. The salt's going to help the water to get better absorbed, and by better absorbing that water, it's going to help to improve the overall blood volume, and by improving the blood volume, then you will typically see an increase in blood pressure. So The long and short of it is salt is one of the, it's really the most on point tool to try to get blood pressure improved. There are some other things that could be helpful as well, but especially for folks who are dealing with a lot of chronic health issues, increasing blood pressure through salt is one of the most user-friendly ways of doing it. So I hope that information is helpful. If there's any other questions about this or any other topic that you're interested in, just post it in the comment section below and I will do my best to answer in a future video post.